Hey, Dr. Tyler Williams at Pinecrest Dental. Thanks for checking out today's video. We're talking about a question that a lot of people ask, which is something you may be asking, and that's, am I too old for dental implants, or should I be doing this at my age? And there's some important considerations, and it's a great question to ask. And we'll get into that more shortly. But first of all, if you have some questions specifically on if you're a candidate for implants, based on what you want, what type of implants, go ahead and check out some of our previous videos and some future videos on this topic of what an implant is and how it works, and if you should save your teeth versus remove your teeth, because that's a very important consideration that many people are misled on. But specific to this question about age, there are some considerations. Now, overall, more and more research on implants, we're finding that implants are actually a preventative healthcare measure for other medical conditions. And I'll repeat that, which is that implants are actually preventative for your medical health, not just something that looks nice to chew with or eat with or gives you a new smile, although that can be a very important part of it. But some examples are studies showing that your chance for dementia goes up about 55% if you don't have enough teeth to chew and eat with. Cognitive impairment, diabetes, high blood pressure, all of these things happen when we don't have the proper teeth to chew and eat with. And I started finding this in dental school when I would find people at very young ages getting diabetes or high blood pressure. And sometimes these people were younger than me. And this is going back, over 10 to 15 years ago. And that's because when they lost their teeth and they had to suffer with dentures or partially missing teeth, they had to choose more and more processed and refined foods, which contain a lot of preservatives and sugars and additives that are really bad for our health when we're eating them every day, week after week, year after year, and those can cause some problems there. Some other considerations with age is sleep apnea, and I mentioned Alzheimer's, dementia, some of those that a lot of aging adults are really scared of. And we know that, some people say 70 is the new 50 or 60 is the new 40, those kind of things. The oldest patient that I've done a large amount of implants on was 91, and he was still working. He was still active in his community. He still had a great marriage with his wife, and he had some clients. And so he was meeting with people, and he couldn't deal with his bridge that was failing and falling apart that he had done many years ago. And he wanted a nice, confident smile. So that was really fun for us. And, we've seen patients much younger. We've even seen some older that we've done treatment on. But there are different options with implants too. So you don't have to necessarily have the most brightest, whitest Hollywood smile to benefit from implants. But keep in mind all the other medical conditions that it may help you improve with and avoid surgeries and medications. Some of the things you should be also aware of is hundreds and hundreds of medications, and that includes over-the-counter medications, cause dry mouth. And dry mouth can be a really fast way to lose your natural teeth, because dry mouth causes you to lose calcium in your teeth. And it's not just about drinking more water. Saliva does three things for your teeth. It brings minerals, it brings good bacteria, and it brings water. So just drinking more water alone is not going to do it. So you want to work with a qualified dental team that understands dry mouth and some things you can do besides just drinking more water. Plus, that might just make you have to go to the bathroom more frequently, which isn't always enjoyable either. If you have diabetes, you still could be a great candidate for implants. If you have osteoporosis, you're still often a great candidate for implants. If you've had chemo or radiation therapy, you can still be a candidate for implants. If you're on blood thinners, you can still be a candidate for implants. You just need to make sure that things are done at the right time. Some studies are showing that people who take antidepressants, certain types of antidepressants, may actually have a slightly reduced success rate with implants initially. So you'll want to talk with your dental team about medications you're taking. Same thing with medications for things like acid reflux and heartburn. Those have shown to have some very, very slight impact on the success of implants and your bone growing to the implants. But over 15 years, 14 years of doing this professionally in my practice, is we've had very few patients who truly were not a candidate. And that was usually people with extreme medical conditions where they're severely impaired, and those are usually few and far between. So if you have some more questions on this, feel free to visit our website or call us at the number below. We do have a book that I personally wrote about the 3 keys to a new smile. So if you're looking at a smile transformation or a new smile, something you'll probably want to check out so you can be aware of what happens before, what happens during, and then what to plan for after if you're going to put all this time and money and visits and resources into a new smile. It's something that could dramatically change your life. And I've seen it happen many, many times. But it's also instructive on new ways of sedation to make dental visits more comfortable. And so you hopefully forget about what happened or won't even remember it in many cases. So let us know. We do have a few copies of those available, and we'd love to give those to you at a consultation. And if you qualify, we can talk with you more about the next steps. So thanks for checking out this video, and we look forward to seeing you on the next one. Have a great day.